Muhammad Musa. I grew up in Chicago and did my undergrad in Chicago, and I eventually went to med school in the Caribbean at St. Matthew's University School of Medicine on the Grand Cayman. Did my residency at Central Michigan University, formerly known as Synergy Medical Education, in Saginaw, Michigan, Central Michigan. And then upon completion of my residency, I moved to Ohio, where I currently practice in the city of Cuyahoga Falls, just outside of Akron, in a primary care setting, with a little bit of urgent care that I do several shifts a month. I've been doing that for about 8 years now, since August of 2012. I have a family, my wife, 2 kids, the 2 daughters, 9 and 7, full of energy, and enjoying life, enjoying what I do now. So family medicine was my first or second choice of residency. I've always wanted to do primary care. That was my interest all along. And I really, it was really between the two. But I chose family medicine because of, honestly, the lifestyle. I've always wanted to have a family, and didn't want to spend my days in the hospital as a surgeon. But family medicine was my second choice, and I was very happy with that choice. And as IMG, definitely it's one of the more simpler residencies to get into, and to interview for, and to get accepted, essentially. But yeah, family medicine is a great specialty, and yeah, I chose that. Experience with family medicine residency, honestly, that was I had a 3 great. I mean, you probably don't hear this a lot from residents, but I enjoyed my 3 years of residency. It really was a great experience. Yes, it was tough, 80 hours a week, working weekends, learning a lot. It was a steep learning curve. But honestly, I was surrounded by great mentors. One of them, and I'm going to give a shout out to Dr. Ed Jackson from, he was the program director when I started there. He actually left that program as soon as he finished with our class. He said, "I'm going to leave on a high note with your class," and he ended up moving to Florida. But yeah, I was with great director. Dr. Jackson was the AFP president for 2 years, in 2003, 2004, I believe. Dr. William Maroney, really great guys to be around, great mentors, and I learned a ton. I started with my program. It was, when I first started, it was a community program, actually. Then it transitioned to a university program by the end of my 3rd year. But because if it was a community program, I had such great experience with hands-on. You're kind of thrown into these rotations. It was phenomenal, really. I had a great residency. It was tough at the time, but after you finish, obviously hindsight's 2020. So I feel like I have good memories. So my PGY1 experience. Wow, it's been like what, 10 years since I've done that. But the first year was daunting. Absolutely, before I started, I was terrified. I mean, everything you've learned up to that point was theory. I mean, it was nothing quite practical other than the rotations. I mean, you shadowed in your rotations, but it was theory. So the first day you're handed that pager, it was daunting. But what I've always had solace and I was comfortable with is that I knew my attendings were just a phone call away, and I knew that my senior residents, who were great residents, they were just right there. I didn't have to really feel like I have to sink or swim it. So that was a great experience. And what do you recommend to residents to do heading into PGY1? Honestly, review everything you know. I mean, honestly, I would crack the USMLE books, review those. I would even buy the right books to start residency. I recommend maybe even, there's a book called SOAP for Internal Medicine. I think there's a new version of it. It's a nice pocketbook to have in your white coat all the time, because your first few admissions, as you know, in the hospital, internal medicine, or whatever rotation you're on, you're going to be expected to write orders, and that was like, oh my, well, where do I even start? So the books, the pocket books were great, but really another good resource for the senior residents. Again, I can't stress enough. If you have good senior residents who can help you out, they will be your rope, your life vest, essentially. So ask them as well. I would say buy the pocket books that you need to learn how to do admissions, and talk to your senior residents. If you're already matched, a couple of weeks ahead of time, send them a message, ask, hey, what do you recommend? What book should I bring with me that would help me, kind of get started with admissions and being in the hospital and in the clinic. So yeah, that's what I would recommend. And review a lot of what you've already know. Just review some basic knowledge, because they will grill you. I'll tell you that. I mean, Dr. Jackson, the first time, he will make you cry if you don't know your information. So yeah, prepare yourself. All right. And so the ideal candidate for family medicine, I would imagine it to be somebody who is honestly laid back. Family medicine tends to be kind of laid back residency, but also somebody who's willing to work hard and learn. Because in family medicine, you're not dealing with one thing like cardiology or neurology. You're just dealing with one organ system. You're dealing with everything from pediatrics to OB to surgery to you're dealing with everything. So you have to be willing to do kind of all trades in the same place. So the perfect candidate would be somebody who's flexible, somebody who's going to compromise, who's willing to learn, will take a constructive criticism well. That would be the ideal candidate, really. Again, I mean, some people over stress the scores and everything else, but I think overall picture, the overall resident is going to be the well-rounded resident who's willing to work hard. There are so many aspects of residency candidate, but there isn't one. If I have to pick one, it's going to be very difficult. But I will go back to my experience in residency. If I have to pick one aspect, it would be if this person is, or this future resident, is he gonna get along with the rest of the residents? He's gonna be compromising. He's gonna be a team player who will help out when needed. That doesn't flake out, doesn't kind of disappear when needed. That would be the ideal candidate, or the one of the aspects and that would make this person more attractive to us. Obviously, you have to know your medical knowledge. You have to know what you're talking about. These other things are important, but being a team player is really crucial. What I like most about being a family medicine doctor is really the flexibility. I work in a multi-specialty group with I really control my schedule, and that's where the beauty of family medicine is. I control my own schedule. And then also the aspects of medicine and practice itself, where I get to see everything. I get a huge, wide, broad spectrum gamma of different things I deal with. It doesn't get boring, really. I mean, one encounter would be simple procedure. Next encounter is diabetes. Third encounter is depression. Fourth encounter is a pediatric patient. It's really beautiful. You don't get to do the same thing over and over and over. Things don't just become routine and boring after a while. It's still challenging in family medicine. I'm not going to try to make it all rosy and without it's challenging. But that's what I really like most about it. It's flexibility of my schedule, and the cases that I get to see, the variety of cases I get to see is really, really nice. Some of the challenges that will face family medicine physicians, I have to say, just one of my biggest pains in practice is the insurance companies. If we can solve that issue of insurance companies and their bipolar way of dealing with medications and tests, is really probably one of the most challenging things. So when we talk about socialized medicine, yes, it has its own downfalls as well. But if we need that would be the challenge I would love to solve. And I have my own ways of doing things, but that's one of the challenges. Another challenge would be the time. I mean, right now we are pressed to see a certain amount of patients per day. So sometimes you feel rushed. You may not give your patients all the time that you really want to give them, simply because your schedule is tight. And that's being solved, I would imagine, in the next 5 to 10 years with how CMS reimbursement is going. So it's going from pay per service to pay per performance, meaning you're not going to get paid per visit. Certain code you use and you get paid for it is going to be how well is the patient doing. Are you managing the diabetes well? Is the diabetes under control? Are you preventing them from ending up in the hospital? Are you preventing heart attacks and strokes. So the better, the more you improve that patient's quality of life, the more reimbursement you get financially. So that will take off some of that stress. And I think that's the future of medicine, essentially, especially in family practice, family medicine. If I was a family medicine residency program today, I will not pick one specific criteria for a resident. That does not work. I would rather have a completed a complete portfolio of that resident where I see all of their strengths and weaknesses, and not just go by, let's say, USMLE scores. Even though I have to admit, a lot of programs, that's what they do. They have a cutoff, and so the reason they have to have a cutoff on your USMLE scores is they get a, I mean, over 50. I mean, I remember my program had over 1,500 applications in 1 year. So the easiest way to weed out a lot of these applications is to put a cutoff on your exam scores. So they do that. But here's the thing: as soon as you do that and you weed out all the people who are under that score, that cutoff, then that's the beauty of the application process starts. That's when we start looking at the person itself, the person himself or herself, their weaknesses and their strengths, and what they can bring to the program, and what we're trying to avoid in our program. So yeah, so I think, I would rather have a well-rounded resident start with, again, who's willing to work hard, willing to compromise, willing to chip in anytime he's needed or she is needed, than just, let's say, a top scorer on USMLEs. So I chose to go to St. Matthew's University School of Medicine for several reasons. One is I've had family members who've been there. My own brother, Dr. Z, who's the founder of Matt's Residence. So he had been to St. Matthew's before, and some of his friends, and heard good stuff about the school. So that was not a very difficult choice. The location of the school, it's located on the Cayman Islands, which to me was basically an extension of Florida. So it was good, and it was beautiful, one of the most beautiful islands on earth. One of my favorite places really to visit. And my experience in med school, honestly, I know in the weeds of medical school in the first 2 years of basic clinicals on the island, it is tough. But I had a great time again. I had a good group of friends around me that we helped each other out. We hung out on days that we took off. Had a great experience. If I was to say, I mean, I like to give you the rosy picture, but let's be honest as well. There are some medical schools in the Caribbean that could be really shady. So do your homework before you choose which school you go to. Make sure the passing scores are high enough for you. Make sure the location of the island is safe and conducive to studying as well, without a lot of distractions. Really, I mean, that's really all I could say about that. St. Matthew's was a good school. Obviously, most of us would have chose to go to U.S. medical schools if we were able to, or if we had high scores, or for whatever other reasons that some of us had gone to the Caribbeans. But St. Matthew's is a good choice. I enjoyed it. All right, so the most important piece of document in the residency application that we look for in residency is, let me put a couple of things. So I was the assistant chief resident in my second year of residency at Central Michigan University, and I was the chief resident in my third year of residency as well. So I got to see a lot of applications. I got to interview a lot of people. So after the candidate makes the benchmarks and they get an invitation for interview, scores at that point honestly do not matter. Nobody looks at them. You made the interview process. I don't care if you got a 99 percentile on the exam, 240, 250. I don't care if you got 200. You made it to the interview process. Now we're looking at you as an individual. So there's not one document. If I have to say one document, would probably be the personal statement, because that kind of tells me who you are as a person in your own words. So I really recommend taking the time to develop a good personal statement that tells me about you. Don't say anything negative about yourself in that document. You only have one page to write, so keep it positive. Tell me in that process, in that document, what you want to, what you're willing to bring to the table. What are your strengths? Don't talk about your negatives, because we're going to ask you about those during the process. So So, you can, and don't volunteer negative information. Just tell me your positives. If I see something in the application that I'm concerned about, I will ask you about it, and I'll give you a chance to kind of defend yourself in that situation. But if I have to choose one document, it will be your personal statement. Absolutely. So what we focus on candidates during the interview process is honestly, first of all, uh, I make sure the person is well dressed. They can speak well and with well-formed sentences. They don't have trouble with the English language. That's kind of big. So that tells me down the line if I'm going to have trouble communicating with you. Their body language, are they comfortable? Are they confident in themselves? Are they confident in their knowledge and their experience? We also focus on their interactions with others, with us as mentors or as interviewers, or how they're interacting with our staff. Really, I tell you what, the office coordinator will make you or break you. If you walk in and you do not give a good first impression, she will talk to me, talk to the directors, she'll talk to the professors, and she'll say, this person did this or that. So definitely the person has to carry themselves well, and it's your time to shine and represent yourself. So dress well, talk well, clearly, be nice to everybody, be cordial, be understanding, be compromising if there's somebody's running behind, and really be yourself at the end of the day. The candidates that we will rank highest in the rank list will be may tie to another question we talked about earlier, was um, the complete candidate, the candidate that has decent scores. It doesn't have to be high, extremely high numbers. It's the candidate that has decent scores, but has a full portfolio. This person has had he had passed his exams, no troubles, had volunteered in his life, had spent time with in underserved areas, maybe somebody who is willing to compromise, somebody who's willing to work hard with us, somebody that will get along with other residents and not give us essentially tough times. I'll tell you from the days of residency and interviewing, as residents, we used to get a lot of say on who we rank. I remember the rank day in February. We used to sit down in the conference room with all about 18 residents, the 5 attendings, and the office staff, about 35, 40 people, with a projector and literally a picture of every candidate that we interviewed, and their criteria that they matched, and everybody will get a word to say if they want to increase this person's on the list, put them closer to number 1, or drop them down to lower. And I'll tell you the truth, a lot of residents didn't care about the scores of their exams or anything else. They cared about how that candidate interacted with them. How did that candidate carry themselves in the interview process? Did that candidate get into a match with any other residents, or were they cordial and they carried themselves really well? It was really first impressions. I have to admit, there's a lot of these residents were just, hey, this person was really nice. I think I'll get along with him. I want to bump this guy up closer to number 1. And then we've had candidates where, I remember we had 2 ladies who got a little more drunk than they should have on the dinner night and the night prior, and that blew off their whole. I mean, the minute their pictures came up on the screen, everybody said, "Nope, drop them all the way down. These people are not going to be welcome here." So yeah. So it's the candidate that will rank highest is somebody that would be relatable, has passed their exams without any trouble, they're willing to work hard, and they can show us that. So let's talk about the residency application process overall. So I'm going to give you 2 perspectives here because I've been on both ends of the spectrum here, as an IMG applicant as well as a chief resident and an assistant chief resident who's actually interviewing candidates. So my first part of the question would be my experience and my application process as an IMG was really, it was very similar to even the American graduates. Obviously, it's the same system of application. But in your application has to be completed and intact before you send it out. It can't be missing scores. It can't be missing transcripts. It has to be complete. Residency programs will chuck out your application if it's incomplete. So make sure your application is completed before you send it out. Um, if you have any gaps in your medical education, you have to explain that. Make sure on your resume and your CV, you mentioned if you've taken a year off, like for example, I didn't match the first year. You have to just tell the program ahead of time in your application why you had a gap year and what did you do with that time. If you didn't do anything with it, it will look bad. So make sure if you have a gap year to go ahead and fill it with either research or some kind of volunteering, something related to the medical field. And then you submit the application electronically and you wait for invitations. I got numerous invitations, numerous interviews, and I've honestly went to almost all of them. I've got more than 10 or 12 interviews. And then, after each interview, make sure you write down the names of the people you interview. Every single person you've sat down one-on-one, you write their names down, because after you're done with this interview, as soon as you get home, you're going to write thank you letters and send thank you letters. That's very crucial, because as interviewers, we don't remember everybody's names and who looked like what. I mean, we have our notes, but we'll refer to these notes towards the end of or before we start doing the rank list. But I'm not going to remember who you are. Now, I will remember the ones who sent me a note with their name on it. That person will definitely ring a bell, and I'll go ahead and pull up their application again and see who this person was. Some people you're going to remember right off the bat, people who make a great impression on you in the first walk in the door, those you remember, but the vast majority you may not. So send thank you letters, but don't be overburdened as well. Don't be a burden on the program. We've had people who have sent numerous thank you letters, which not a good sign. Just it looks desperate and trouble. So just one thank you letter within the first week after the interview, it's a good idea. Sometimes some residents will send another reminder note about a week or two before the rank list comes out. Great idea. I would do that as well. So go ahead and do that. From the other side, being as an interviewer in the residency, it kind of ties in what I kind of mentioned both at this point, but yeah, so the process is we get the applications on the day that we open the application process. And like I said, our program used to have a cutoff for step 1 and step 2. If you make that cutoff, then you get interviewed. Believe it or not, we used to allow the first attempts. If you had failed once your step 1, we would allow it. In the most recent years, we have not, and simply because we have the amount of applications have tripled in the last, I would say, in about 3 years when I was in that program. When I applied for residency that year, our program got about 800 applications. By my third year, we had over 1,500 applications. So we had to have a cutoff. So we weed out people depending on their scores, and then we'll get stacks. The assistant resident will get a stack. The chief resident will get a stack. Every mentor, every advisor will get a stack of applications to go through and decide on which ones are we gonna give interviews. And then after that, we weed it down to about 100 interviews, no more than 100 usually. After the 100 interviews, if we had a few candidates where we're like, absolutely not, this person is not coming here, those applications get chucked out and they won't get ranked. And then we're down to a list of about 50 to about 60 candidates that we actually rank from 1 to 60. And like I said, that process keeps kind of building over time until the day of ranking list or the day prior, where we sit with the director and all the residents, all the staff, and all the mentors, and we start ranking. Usually the list comes ready, preloaded by the director usually, and then he'll put the list up with the pictures of all the residents and a little bit of some comments on the side of highlights about this person and what they bring to the table. And then we start working on either bringing somebody up closer to number 1 or bringing people down closer to 60. And that's how we do the rank list. And like I said, I'll reiterate, residents and their experience with you as a candidate is very important. Make sure you leave a good impression, because that's essentially what residents will remember at the end. They're not looking at your application that closely. They remember you as a person. So that first impression, the way you talk, the way you dress, the way you carry yourself is really important. So keep that in mind. The IMG applicants. Really, you are not any different than a U.S. graduate. Your experiences, your education is just as solid, because most of these medical schools, it's really what you make out of it, right? So, coming from a U.S. school or or Caribbean school or IMG, it doesn't matter. It's what you make out of it. So scores are important. I'm not going to try to sugarcoat it and tell you that it doesn't matter. Yes, it matters. The scores are important. Step one and step two are important. But it's not all based on that. There's some cutoff. There's some minimal criteria you have to meet. But even in our program that had minimal criteria, we made exceptions to certain people that we thought were good candidates. Maybe they didn't, they were not great test takers, but they were a good candidate overall. And we've interviewed some of these people. Um, so if your scores are not high, don't worry about it. Carry yourself strongly, because you're not just your score. You are a complete candidate with experiences, volunteer experiences, research experience, undergraduate experience that really will bring a lot to the table to your residency program. So apply, follow the deadlines, follow the recommendations. Make sure you have a good residency, a good personal statement. Make sure your CV is complete and doesn't have any gaps in it. Um, and just prepare yourself for the interview the night before, and just really enjoy the process. It's a long process. I know with COVID-19 right now, yeah, it's a little different with the Zoom meetings, but it does still, it's not, the only difference is you might not be interacting as much with the other residents, since it's just an interview over Zoom. But make the best out of it and complete your program. I'm an IMG myself. My brother was an IMG as well, and several of my cousins and good friends have gone through that process, and we had no trouble. Just make sure you prepare for it.